This is a special interest report on a proposed evidence-based blood flow restriction screening and application algorithm. Though recent systematic reviews have demonstrated that BFRT or blood flow restriction training is superior at increasing both muscle strength, hypertrophy, bone metabolism, and functional capacity in comparison to work-matched controls, amongst rehab professionals, there is considerable variability in the screening process in the initial application of BFRT. The purpose was to propose an evidence-based BFRT screening and initial application algorithm that was clinically friendly and synthesized the current best evidence. There are several decision points, including 5 screening decision points, as well as 3 initial BFRT application decision points. The algorithm was implemented across a year's time in a hospital-based outpatient orthopedic sports medicine clinic by 5 BFRT-trained physical therapists across 408 encounters utilizing an FDA-approved pneumatic tourniquet system put out by Smart Tools Plus. All cuff pressures were individualized to the patients. The patient's mean age was 36.7, but had a large distribution of plus or minus 9.8 years. 70% of the patients were post-op. Of the 408 encounters, there was only 2%, that is 8 responses that were adverse in nature or had side effects, all of which were well documented previously within the literature as side effects, and they all self-resolved upon reducing the pressures. If we turn our attention now to the algorithm itself, you can see that there are several decisions that need to be made by the treating therapist. Put simply, can the patient benefit from BFRT? If so, screening the contraindications in the EMR and this subjective screening tool, which you can access further detail on the subjective screening tool that will give you a point stratification by using the QR code in the top right portion of the screen. Informed consent of the patient is necessary. At time points, you may also need the MD consent. Is there any active effusion? If so, control it and treat it. Perform your limb occlusion pressures once the inflammation and effusion is controlled, and determine the appropriate type of exercise. Again, I turn your attention to the QR code that would allow you to see a YouTube presentation and go further in depth with these decision points. The clinical applications is that this provides the advantages for the rehab professional that standardizes the screening process, that allows for improved consistency of clinical application of the current guidelines, enhance reliability of patient screening, mitigates patient risk and prioritizes safety, and offers a comprehensive and repeatable screening process that can be used in clinical practice. The future implications of BFRT in rehab and return to activity are promising. The described algorithm will assist physical therapists in being pioneers in establishing clinical practice standards of safety and proper application of BFRT.